Thank you so much, Sue. And I'm just going to share my screen, everyone. I'm delighted to be here. And wasn't it just fabulous to hear Molly? Oh my goodness, I could have listened. I could have listened and kept listening. So so delighted to be here with you, and thank you so much, everyone, and particularly Sue. I'm here to talk to you about some work that I'm doing with colleagues, and as Sue has said, it is a passion of mine. I mean, how we care for our colleagues, how we look after our colleagues, obviously impacts on their life, but it also impacts on how they therefore can then care for the patients, the women, the clients, whoever it is that they're looking after. So I'm delighted to work with a group of colleagues. Dr. Paula McFadden is leading on this project. She's a social worker by background, and we're looking at health, so that's nursing, midwifery and AHP, and social care workers, including social workers, health and wellbeing during this COVID time. This is a 3-phase study, so actually I'm just telling you about phase 1, the survey that completed earlier or last year, and we've just literally closed our second survey at the end of January. So we're working in that multidisciplinary team. We have colleagues from my own university, from Queen's University in Belfast, from Bath Spa University, from King's College, and so we've a range of people working on this project, which has been great. So the main overall aim of this study is really to examine the impact of providing health and social care in health and social care on nurses, midwives, allied health professionals, social care workers and social workers. We had an online questionnaire and it focused really on the things you would expect. On the demographics, we needed to know a little bit about the background of the people who are responding. We also used the Short Warwick Edinburgh Mental Wellbeing Scale, and this focuses on mental wellbeing generally in the population. It's a very good measure, it's a very quick measure, and picks up really 7 statements about thoughts and feelings which relate really to functioning and how you function and how you cope. And then we also looked at work-related quality of life. And again, that's very important. How we actually feel about our working life is very important. It impacts on our mental health and physical well-being. We use then the brief cope scale, and that relates very much to effective and ineffective ways of coping to do with stressful life events. And clearly working during COVID has been quite a stressful life event for many. We also then used, we thought it was very important because the work life, family life interface has become so important. In fact, for many, the two lives have merged really. We thought it was really important to look at what how people were coping with the additional stressors placed on work and family life and how that impacted on them. And we had also some qualitative open-ended questions, including one that asked people's views on the clap for carers phenomenon, as I would like to call it. So from a demographics point of view, we had 3,290 responses from across the UK. Most of the responses came from Northern Ireland, while just over 1,000 came from England and some from Scotland and Wales. Most of the samples in that first survey most of the respondents came from social workers and social care workers. And we had smaller numbers of midwifery respondents, around 180. And about just under a quarter of those were from England. We had a larger number from Scotland and about 45% from Northern Ireland, with just a very small number of midwives responding from Scotland. Midwives, although the overall age group for the sample really fell in the 40 to 59 age group predominantly, for midwives' point of view, actually most of the midwives fell into the 30 to 59, so there was a younger band of midwives who responded as well. And most of the midwives worked in the community, most of the midwives worked in the hospital, whereas actually the overall sample base was about community-based individuals and professionals. So a little bit of a mix there. So the key findings, we were focused, as I've said, on staff wellbeing and coping. and we themed it as you would expect us to do, the findings. We had a vast range of findings, and we themed them under the 3 C's, really: the changing conditions, connections, and communications. And it was fascinating, really, the key aspects that came out of the findings, out of the results from the survey. And they focused on things like safety, things like, as you would expect, PPE, particularly in the initial stage. If you think back, that the survey fell back into March, April, May sort of time, whenever things were just really starting to take off, and where there were quite still challenges for the healthcare providers in getting PPE to their staff, and staff being able to access the PPE that they felt safe in. There was an issue about work routines. The whole idea about people's work conditions and had changed, where they worked, how they worked, their hours of work, the expectations around their work. Redeployment was quite an issue, and I'll talk a little bit about that later, about the pressures that put on some individuals. Work intensity. So it was quite interesting. We had those who felt that they had nothing to do, those who thought they had a little bit more to do, and those who felt they had too much to do. And that was because of the services they were in, because some services stopped, some intensified, and some just escalated beyond the expectations of any previous work that they had undertaken. And that home work interface was very important. Sometimes people found that they were now working at home and that they had to balance that home life, the homeschooling, all of those additional pressures with trying to maintain their working life. It was interesting, most of our respondents were female, as you would imagine, so clearly an awful lot of those pressures did fall to the females within the household. From a connections point of view, employers, really the importance of employers taking time to connect with their employees was seen to be very important. Seems to be an obvious thing. However, some did it very well, some did it not so well. And it really came across sometimes that it was really down to individuals. It really came down to that individual, that person that was your manager, the person that you linked with. It really fell on them about how well they did that and how well they connected with their team. Some people felt that it improved quite a lot, actually, because people made an additional effort to keep in touch and to be connected, and they felt that things had improved quite well and improved their overall team functioning and camaraderie, which was interesting. Service users, the connections with service users, some of our respondents felt they were very concerned about their lack of connection with service users, the fact that they couldn't see them face to face. Sometimes they felt that they couldn't have the same interaction with them, they couldn't give them the same input that they previously had, and they were really quite concerned about that. And the connections with the public, and again, that fell back to this whole clap for carers, the whole relationship with the public, how they were perceived. One minute they felt they were perceived as the angel, and the next minute they were perceived as somebody who was doing everything wrong. And I think there was some of that came across as well. From a communications point of view, many of our respondents felt that they got contradictory information. Sometimes people felt that they just got a flood of information that they couldn't interpret, but were expected to interpret for themselves. Some people felt that they got information that was more relevant for the hospital setting, and yet they were in the community setting and they were expected to interpret it and try and apply it in their area. Some of our respondents felt very isolated. Now, it's not quite different really from a lot of people in the general public who have expressed the sense of isolation that was felt during the initial phase of COVID, and obviously since then as well. Some people felt they were, particularly those who perhaps lived on their own, they felt if they worked from home, lived at home, they were always on their own and they felt quite isolated. And some people felt quite frustrated and demoralised because they felt they couldn't give the care they wanted to do because of the challenges and because of PPE, because of all the things that were happening. And some felt quite demoralised by all of that. So we'll look a little bit more at that as we go through. Some of these quotes come directly from our respondents. I've tried to give a mix across the professions. And as you can see, some people felt that their immediate team management didn't do an awful lot for them, but their executive team higher up within their organisation were quite good at keeping them up to date and ensure that they were aware of what was available for them for health and well-being. Some people felt that they were very concerned, as I've said, about the fact that, women were concerned about going to the big hospitals, and therefore they wanted to birth more locally in their local units, or perhaps even, as we've seen, I know in Northern Ireland, an increase in demand for home births, which of course led to additional challenges for the service providers. So there's lots of changes in the way that people looked about what they wanted done and how they did it. From the CAP for carers, as I've said, some people felt that they either liked it, didn't like it, sort of liked it at the beginning, then got fed up with it. It changed as time went on. But equally, there were some times, particularly within social care, people felt that they were excluded and that they weren't really part of that CAP for carers, that they didn't actually fall into that group. From a safety point of view, then, within these changing conditions, clearly people were quite fearful at the beginning, this fear of catching COVID from women or their partners, and indeed passing it on to women and their partners. There was concerns around that as well. People having their work intensity change, not just as I've said earlier about the whole idea of service changing, but also the fact that people had to go off because of illness, through shielding or through stress. And that did impact significantly on their conditions, their working conditions. Redeployment caused quite a few pressures. And indeed, you'll see later on that those who felt that they hadn't been well prepared for redeployment felt extremely stressed and felt that they hadn't been given an opportunity to decide where they would redeploy to. It was really led by service demand, not necessarily against their skills or their wishes. And from a work-life point of view, some people again felt that there was quite a degree of understanding shown to them with regard to the demands on them from children and working at home and all of that. But some felt that they didn't get a lot of response, they didn't get a lot of caring or understanding or empathy shown towards them. Some people felt they just had to get on with it. From a communication point of view, as I've said, there was some contradictory information and people didn't feel that was therefore at all helpful. Others felt that there were good daily safety briefings, things that they needed to know about that they got succinctly and they were told about in clear terms. Yes, again, the PPE, people feeling that they got some information that was totally irrelevant to them in relation to PPE, not getting appropriate guidelines depending on where they worked. So there are ways of coping then. How did people cope? And there were a range of coping measures used, and clearly those more active coping measures actually showed a higher benefit to the individual. So if they could show acceptance, positively reframe things in their mind and plan and feel that they had some degree of control, they fared better in how they coped. Nurses scored higher than all occupational groups on the use of venting. Now we wouldn't expect that, would we? Midwives didn't come out strongly. That came out really, they just came across, really they used quite active coping strategies, and AHPs scored higher than others on religion. So it's quite interesting how these things fall out. Interestingly too, across you can see across all the professions, the total wellbeing score was quite similar, but this is about 2 points below the general wellbeing score of the general population. So that's quite interesting, and that's quite a significant drop. So it's interesting to think that the wellbeing of our health and social care occupations is below that of the general population at this time. So with regard to quality of working life and coping, as I've said, active coping, use of emotional support, recreation and relaxation did predict higher work-related quality of life scores as well. So those who actively used coping, who felt more supported, used recreation and relaxation, had a better working quality of life as well. So it impacted, those active coping strategies impacted on their well-being and also on their working life. There were no overall differences between occupational groups for age, gender, or ethnicity. And respondents from Northern Ireland and Scotland had lower work-related quality of life scores on average than those in England. Having a disability and reporting sickness in the past 12 months predicted lower work-related quality of life. And as I've said earlier, lack of preparedness for redeployment also impacted quite markedly on quality of working life, the additional stress that people felt they were under. So, looking forward, and what are the implications? What are the issues that we can think about, that we can say, well, look, what can we learn from this? What can we do? Because we've presented this to some of the trusts, not only in Northern Ireland, but in the rest of the UK. And they've been saying, but what can we learn from this? What are the things that we need to do better? And clearly, an awful lot of the trusts have done an enormous amount of work. Health and social care organisations have tried on many occasions to meet every possible need of their staff, but they still feel there is more that can be done. And clearly there is a need to offer flexibility around working hours and locations. And sometimes people felt that, you can't tell everybody to work from home. So does that mean we tell no one to work from home? Because it's not fair if we let some people work from home and others can't work from home. So there was a lot of that. So, managers did describe that concern about their colleagues and about trying to do the best for them. And it is about how we work that out and trying to ensure that there is equity, not that we do the same for everybody, but that people feel that there is flexibility offered to them right across, not just to some, but for all. So that's a challenge that still needs to be addressed. And some of that comes down to the availability of workers, the availability of staff, and the nature of the work that people do. Some staff felt were more keen to be involved in decision making and to use their autonomy. And some of our respondents actually felt that worked better during lockdown and whenever they were working from home, because they felt they were less accessible and people just made decisions and got on with it. And they felt that therefore there was less of that going up through the system to make decisions. So that did work well. And it seems that our staff are keener to be more involved in decision making and to have to be more autonomous in their own decision making in relation to their roles. The connection with colleagues and managers was really important. As I've said, some people felt it was done very well. Some people felt that their team morale improved, their connections improved. People talked about having, Zoom bingos and Zoom picnics and Zoom coffee mornings and all sorts of things, and every other Zoom possible or every other IT platform, of course, that you may wanted to use. But people felt that could have worked, that worked well for them, and it did help with morale. It did help connection, staying connected, keeping in touch, knowing what was happening, and seeing that actually things outside of work, little things within work, but that were not focused on work, actually quite worked really well in helping to build up morale. Visibility of management was important, and clearly people were aware that couldn't always be in person. A lot of it was virtually, but that was seen to be very important. Visibility, being seen, connecting in, saying hello, how are you, and listening and hearing what their staff were saying to them was seen to be very important. And also that they were taking on board what staff were saying and trying to deal with some of the issues. I think staff were very aware that not all issues could be addressed, but they felt that when at least managers listened and did try to address things, that did make a difference. Skills training and preparation for redeployment. Again, this issue of redeployment came up on a few occasions. It was very much about, people understood that on occasions they need to be redeployed, but they needed skills, they needed the training, they needed the knowledge, they needed prepared. And some of that was even that psychological preparation, giving themselves time to get used to the idea of going to somewhere else and getting used to a different team, to a different way of working. And in some cases that just wasn't possible because of the speed and how the employers felt they had to react to deal with the crisis situation in front of them. General health and safety at work, you could tell at the very beginning people felt that things were good for some, not very good for others. But as time progressed and as PPE became more available, as people became more used, I suppose, to the whole approach of social distancing, hand washing, sanitising, being careful and being aware of general health and safety rules and regulations, people adjusted and became more at ease. And you could see that. So it's interesting, as I've said, we've just finished our second survey, so it'll be interesting to see whether PPE comes up again. We have included this time some questions around resilience to see whether people have built up any resilience over time to how they've had to work. And then well-being and taking leave, that was a very important thing as well. There was quite a few people who did say our managers did try and say, okay, let's take some leave, take a day, if you can't maybe take a week, but take a day, take 2 days, have a break, take time away, go get a cup of coffee, take a break away, if you're at home on your screen, do take a break, walk around the house, walk the dog, and some managers were encouraging that and saying this needs to be done. But I think generally we need to get better at saying that it's okay to take a break and it is good to take your leave. Because, if we're not well, we just end up breaking. So we do need to look after ourselves. That came across very strongly. So thank you for this opportunity to share our findings. The second survey, as I've said, is just closed. We have another one going out in May. So please do look out for it. We really would love to get more response from midwives. We had, I think, less response this time than we did the last time. And we have reached out across the UK, but we'd be very happy. And if anyone wants to get in touch, there is a study website now. You can see it there. The web address is there. And I'm very happy for anyone to get in touch with me on my email. I'm very happy to contact, to get back in touch with you. We also will be doing more focus groups. We've done some focus groups since our first survey closed, and we're just analysing that data now. And it's interesting, we've sort of used some of that first survey response to help inform those focus groups discussions. So they've been fascinating, actually. And so I'm really looking forward to seeing that come out. But we will get it up on our website as soon as it's available. So thanks so much.
Fabulous. Thank you so much, Patricia. That was really so interesting. And especially as you're talking and inviting people, for those of you who are watching, I haven't had any questions coming through, but I think the snow is affecting the internet, because I think I've just had a couple of questions for Molly, who's not here to answer them. But slower. Also saying how good the session was. But so was yours, Patricia, and that was really useful. It'll be interesting to see what people are feeling, because I think the overall feel is that everyone's really tired, and the people who are directly engaged in intensive care and high dependency, etc., are tired. But I think that goes across the board, and it'll be interesting to see how that actually plays out in the survey you're analysing now and the future one to come, because we've still got a little way to go, haven't we?
We have, yeah. And it is very hard. And I think regardless of what role people are playing, I think that homework interface has changed for everyone, because so many more people are working at home. And, even for those who aren't working at home, they may have children at home that they're now worried about, that they're still expecting to go out to work. And yet, who's going to look after their children? Do you know what I mean? Because they don't maybe have the usual carers or whatever available to them. So there's been a lot of challenges. And I know that mothers are generally really good at adapting and dealing with whatever life throws at them. So by now, most people have it sorted, but it caused an enormous amount of stress to individuals,
it's interesting, the women focus of it, because it does seem, even some of the adverts that have come out that have just simply been withdrawn, which show women in the home more than men, kind of emphasises that the impact is much more on women. And if they happen to be nurses and midwives, and they're also balancing that as well, it puts a heck of a pressure on them, doesn't it?
I saw something the other day a friend of mine put up, and I just laughed. She was sitting in the car to have a little bit of peace before she went on night shift. And it's because, and you just think, gosh, that's the reality. She just had a photo of herself sitting there, and I thought, oh, dear love you. You just feel like you want to give her a hug. And, and it wasn't, she loves her children and everything, but it's just the busyness of life and the fact that it's so full on, and there's so few. You can't, they can't just go off to the grandparents as easily, or they can't go off to, everything has to be much more planned and organized and arranged. And I just thought, gosh, that's the reality, really.
And I particularly like the breaks issue, because that's part of it, isn't it? You're talking about this midwife in her car.
Yeah.
And I know on Twitter, I saw a wonderful image that the midwife was posting in her 10-minute lunch break. She took a picture of the beach. She's a community midwife. Lucky community midwives, if they have that view.
Yeah.
But it's kind of snatching the beauty and the rest and a relaxation where you can. And midwives are fantastically creative and able to do that, thank goodness, because they're going to need that to be able to recover and look after themselves.
Absolutely.
But thank you so much, Patricia.
Thank you.
And we'll look forward to the next part in the story.